Welcome to your pregnancy and exercise mini course. I am so excited to have you here today sharing great information. We're going to be diving into the 5 common myths surrounding pregnancy and exercise. We're going to be looking at what is good advice, what is simply old wives' tale, what the research says, and what we should be paying more attention to. So we're really missing the mark on a lot of advice for our pregnant women. So let's dive in and look at 5 myths that might be somewhat true, all true, or not true at all, and take a closer look at what would be the best advice that we could be giving our pregnant women. It's always safe to continue what you've been doing, just don't start anything new, right? How many times have you heard this piece of advice? Just keep doing what you're doing, all right? I can't think of anything that is worse because it's just so non-specific. Right? Core exercises are safe as long as you were doing them before you became pregnant. Right? Follows the same line of thinking as just keep doing what you're doing. You shouldn't do any sit-ups or crunches while pregnant. Well, is that true? Is that not true? If it's not true, then what should we be doing? Can we get away with it? We're going to dive in and take a closer look at that. Prolapse only happens during delivery, not pregnancy, and there's nothing we can do to prevent it. All right, so this is a myth that is dear to my heart. I really do think there's so much we can do to help prolapse and help prevent it as well as help improve it. We just need to have a lot better education. Pelvic floor dysfunction and diastasis recti cannot be decreased or prevented during pregnancy. All right, so this is along the same line. What can we do to help a pregnant mama not have a severe diastasis recti during pregnancy? So we'll take a look at some case studies and then the why behind the improvement that was seen in these case studies. This mini course is a little bit of a taste of the postpartum corrective exercise specialist course. You do not have to sign up for the course to enjoy this mini course. So just sit back, enjoy learning, and take away some great tips for helping women. You might be a pregnant mama yourself, or you might be wanting to learn more about working with women. And so just take what you want out of this course, and hopefully you will find some information that you didn't know or something that might make you pause and think a little deeper. Before we dive into the course, I want to run through a little bit about my work history, professional history, so that you know who's talking to you. This area is such a passion of mine. I started working with women and men in 1999 as a personal trainer. I just loved the human body. Before I was a personal trainer, I volunteered at the hospital. I volunteered on the physical therapy floor. The human body is absolutely incredible. And I've known ever since the age of 14 that I wanted to go into this field, and it has not wavered since. So I started out as a personal trainer, graduated from PT school in 2005, and after working for a few years, I went back and completed my doctorate work in 2008 on the pelvis, specifically the SI joint. So the area of the core and pelvic floor has always been fascinating to me. I've always wanted to dive in deeper, every pun intended, and understand this area of the body more, and which is why I focused on that area for my doctorate research project. So my passion is helping women get back to doing what they love after having a baby, and a great postpartum recovery often starts in pregnancy. I didn't want to be told I couldn't do things postpartum, no matter what kind of delivery experience I had, and I don't want that for other women either. I want women to be able to do whatever their passion is and not feel held back by their body after baby. I love the human body and solving complex problems. The body can be so fascinating and interesting, but my other love lies in teaching. And so that's why I'm here talking to you today. I want to share this mini course with you. I hope that you will take something awesome away, and I hope you will want to join me in the full course after. All right, so let's dive into the 5 common myths surrounding pregnancy and exercise. Myth number 1, it's always safe to continue what you've been doing. Just don't start anything new. This is probably the most common piece of advice that women get. I actually had someone who was told that she could not start walking because she went in and said, well, I've been pretty sedentary. I've had a sedentary job. I've just kind of slacked off the last few months and really haven't done much. And then we got pregnant. I'd like to start walking again. And she was told she couldn't start walking. I about flipped. I was like, I can't believe you were told you could not start walking. So I think that we have taken this keep doing what you're doing advice a little bit too far. So let's dive into the research and see what the research shows us about physical exercise during pregnancy. So there was a Danish study that analyzed the risk of miscarriage in 92,000 pregnant women reporting physical activity. And they found there was no dose effect with miscarriage among all levels of activity compared with sedentary women. So the results of the study showed that women who exercise are not more likely to miscarriage, which means exercise doesn't cause miscarriages. Now, there is some research looking at an inducible cervix and things like that, but we'll dive into that deeper in the course for those details. So now let's just focus on, can you begin an exercise program during pregnancy? So there was another study looking at 46 women that were 8 weeks pregnant who did not exercise regularly before they got pregnant. They were randomly placed in two groups. One group exercised moderately 3 to 5 times a week, and the other group remained sedentary. All right, remember, these women did not exercise prior to pregnancy. The exercise group showed enhanced fetal-placental growth as early as 20 weeks over the non-exercising group. The exercise group had placentas that were significantly greater functional volume, non-functional volume, villus volume, and terminal villi. So basically they had better placentas. How cool is that? These women were all able to safely start exercising at 8 weeks pregnant, and their pregnancy benefited from it. So starting an exercise program was healthier for the baby than continuing to not exercise. All right, so that is two great studies that can make us feel really good about starting exercise after being pregnant, if you don't exercise before. And if you do exercise before, definitely keep doing it. All right, so you want to just use a little bit of extra caution to prevent dehydration, hypoglycemia, and exercise hypothermia while exercising. So take more rest, drink more water, eat more food while exercising pregnant. That seems like a no-brainer, right? Just take a little bit of better care of yourself. So shorten the exercise time if it's in a hot or humid environment. You just don't want to get overheated or dehydrated. So you can't get away with quite as much when you're pregnant. That just means you need to be a little bit smarter about exercising during this time period. So, exercise recommendations. Exercise in pregnancy has positive effects on the child's metabolic potential due to epigenetics. Epigenetics is a really cool field that gets really complicated really fast. But this was such a neat study that I just couldn't help but sharing it with you guys. So, we are shaped by our early environment. It can make permanent changes to the child's ability to respond to oxidative stress, their immune system, their sympathetic nervous system, and fat utilization. So essentially, we're changing their ability to respond to high stress situations. So a high fat, high fructose diet coupled with a sedentary lifestyle before and during pregnancy creates an utero environment that sets the stage for future metabolic syndrome. I don't know if you need any more egging on to get exercising while pregnant, but this is a pretty darn good one for that vote that exercising while pregnant is healthy for mama and baby. So what does that tell us? It's safe to start a new exercise program when pregnant as long as you go about it smartly. All right, now, what's the other side of this question of the just keep doing what you're doing? Should you keep doing what you're doing if it's a high intensity or strenuous? All right, now that answer is maybe. So in the course, we're going to dive in a little bit more looking at high intensity exercise with aerobic capacity, but what about when it's not aerobic? So let's dive into lifting and some of these other common myths looking at core training and all that kind of stuff through this next question. So core exercises are safe as long as you were doing them before you became pregnant. Well, like most everything in health and exercise, the answer is maybe. They're usually safe until they start to cause pressure issues. So what do I mean about a pressure issue? So we increase pressure to complete a task. If the task is really hard, we're going to need a lot more pressure to complete it. So think about needing to lift a car in the state of emergency. That's going to be a lot of pressure. Maxing out on deadlift or lifting a really heavy weight, that's going to be a lot of pressure. If we want to pick up a feather or a pencil, that's going to be not much pressure. So a pressure issue occurs when we start to get leaks in the system. So this can be distension in the linea alba. Linea alba is the midline of the abdomen where the abdominal muscles come together. So right between that rectus abdominis, right between that six-pack muscle, you can get distension in the linea alba, hernias, leaking, or prolapse. So these are what I call pressure issues. So that is telling me that there is an issue with that pressure system that needs to be fixed. So pregnancy increases the vulnerability of this happening due to the give in the linea alba to make room for the baby and the spread of the pelvic floor to make room for birth. So pregnant woman is just a little bit more in a vulnerable state, which is why we need to use a little bit of extra caution. So you shouldn't do any sit-ups or crunches while pregnant. All right, what do you guys think about this myth? Is it one that you say, yes, it's true, or no, it's not true? All right, well, like everything else, it all depends. So my question that I'm going to be asking is, does a sit-up or crunch cause a pressure issue? Do you see distortion of the linea alba? Does it increase pressure on the pelvic floor to an unhealthy point? Is the person experiencing leaking or increased prolapse symptoms? These are the things I'm going to be going through, because doing that crunch might be okay for their body. Even doing a sit-up, gasp, I just said that, I know, might be okay with their body. So we need to take a look individually at how people are handling things. So this is a pregnant mama that I was working with, and she is in her 7th or 8th month of her pregnancy. So she's getting pretty close to the end. She wasn't quite, I think, 8.5 months pregnant here. She was like between 7 and 8. But you can see how I ask her to pick up her head, and this is the space between her rectus muscle, and this is a distortion, a tenting or doming out of her midline, or out of her diastasis. And it doesn't look crazy obvious, but when you place your fingers on it, I could feel the distortion. So I'm placing my fingers to outline that for you, because most of the distension that happens in a pregnant belly will be popping out. So I have some of my pregnant mamas that are like, I've got an alien coming out of my belly. Or how could my fitness instructor not tell I was pregnant? It looked like the baby was coming out every time I did a core exercise. So if you've ever heard anything like that, you're probably looking at a doming or tenting in the pregnant belly. So when a person is postpartum, sometimes you can get a sinking in of the linea alba, but when they're pregnant, there's no way it can sink in. There's nowhere for it to go. So you're always going to get this doming or tenting in the pregnant belly. Now here is a postpartum woman, and I wanted to post this out because it was a lot clearer to see, and you can see the distortion in her linea alba and how it is doming out when she's doing an abdominal exercise that requires pressure. There we go. We're back to that pressure system, and you can see how the pressure is not being handled well in the middle. All right, so myth number 4, prolapse only happens during delivery, not pregnancy, and there's nothing we can do to prevent it. Nah, I love the word nothing. It is all or nothing is never the case. All right, so this was a study that was looking at POP. So my question that I'm going to ask here is pelvic organ prolapse just a delivery problem? So POP at 36 to 38 weeks of gestation can be predictive of POP postpartum despite having a C-section. There we go. There's our evidence. So the women get prolapse while they are pregnant, and some get it through delivery. There's definitely a lot of risk factors that come with a vaginal delivery, so we will talk about that. But vaginal delivery showed less recovery of prolapse than a C-section. An increase of all hiatal dimensions as well as bladder neck mobility was found from 21 weeks to 37 weeks of gestation in women that hadn't had a baby before so women that had not been pregnant previously. The findings indicate that the changes in pelvic organ support are not solely caused by delivery, but also by physiologic changes during pregnancy. All right, so I just wanted to put that out there. If you work with pregnant women, or if you're a pregnant mama right now and you're thinking about your exercise, I just want you to keep in mind that your pelvic floor is going to be a little bit more vulnerable to distension, which means kind of bulging out or changing shape. And so when we think about that, we want to think about how we're managing pressure, because we've now got an area of the body that has become a little bit more vulnerable. So as long as you're on top of great pressure management in the pelvic floor, things should be fine. But it's where we see these issues with pressure management and issues with awareness that we can end up with some problems. All right, so POP prevention during pregnancy, you want to be mindful of bearing down. All right, so activities that increase intra-abdominal pressure are difficult on the areas that have to handle the pressure, obviously. All right, that includes the pelvic floor, the linea alba, the midline, and common hernia sites. All right, so we are only as strong as our weakest point. This is something that I just want to say one more time. We are only as strong as our weakest point. And during pregnancy, those points can become more susceptible. All right, so we are only as strong as our weakest point. And this is what I just want to keep reiterating to pregnant women, because I am all about going for it. I've done a lot of extreme sports. I love exercise. I love pushing hard. But at some point, you got to just check those dashboard signals. Check what your body is telling you, and you have to know what to check for, because you have to know where those weak points are during pregnancy and postpartum. Sustained episodes of increased intra-abdominal pressure, including obesity, chronic cough, constipation, and repeated heavy lifting, also contribute to prolapse. All right, so it's not just a delivery. Now, there is more of a risk with delivery, especially vaginal delivery, and especially if there's levator ani tearing. But I just want to say there's so many other risk factors that can be included with prolapse other than these things. So understand that there are risk factors that are outside our control, like genetics, pelvic surgery, hysterectomy, or forceps delivery. But there are also loads of factors that are within our control, like great pressure management and really good movement strategies. Number 5, the pelvic floor dysfunction and diastasis recti cannot be decreased or prevented during pregnancy. All right, so this is a personal myth. I'm just going to say that I have not found research on preventing, especially diastasis recti during pregnancy. But what I do have case study evidence for you. So we're going to take a look at that. But first, let's dive into the pelvic floor a bit. So think about the pelvic floor as part of the larger system. So that's kind of how I look at it. All right, it acts as a stabilizer for both the spine and the pelvis. It holds up the pelvic organs, and it controls the bowel and bladder. So the pelvic floor is part of the kinetic chain. It doesn't act independently of the rest of the body. It acts with the rest of the body. All right, the pelvic floor acts with the rest of the body. Prevention and improving the pelvic floor can be as simple as finding the weakest link and improving it, which may or may not be the pelvic floor itself. All right, so my specialty area has become seeing patients after they have seen pelvic floor PT. So when they go see the pelvic floor PT and they can do a Kegel, they're like, okay, but they're still having leaking, or they're still having their prolapse symptoms. And they're like, I can do a Kegel, I can relax my pelvic floor, I have awareness. Then they need this extra troubleshooting. And this is where I have enjoyed the mixing of pelvic floor PT with ortho PT and getting to help these women troubleshoot through the difficult cases and really help them figure out what that kinetic chain is, what the missing weakest link is that is causing the pelvic floor to respond in the way it's responding. So it's often not the fault of the pelvic floor. And that is something that will just continue preaching. It is often not the fault of the pelvic floor, especially when you have some pelvic floor tightness. The fault is coming from somewhere else. Weakest point, this is kind of my checklist that I'm going to go through, the initial checklist. All right, is it the pelvic floor itself? Is it the diaphragm? Is it abdominal strength and tension? Can they maintain a ZOA? We'll be diving into what that is. Postural alignment. Do they have forward head posture? What does their thoracic mobility look like? What is their overall alignment and mobility, and how is that coordinating. Muscle strength, including deep hip rotators, glutes, adductors, they all play a role in pelvic floor strength. And believe it or not, arch strength. Okay, you want to go down a quick little rabbit hole because I love rabbit holes. So when we take a look at arch strength with the pelvic floor, if someone has weak arches, their feet are going to want to collapse in. When their feet collapse in, what's going to compensate? The deep hip rotators. All right, so when the deep hip rotators compensate for the arches, they're going to always be tight because they're trying to lift and pull the feet up. So think about that. If you always have a obturator that's tight, if you always have a piriformis that's tight, if you're always clenching that glute medius, all right, and you're trying to help support your poor arches because your arches aren't doing their job, what do you think it's going to do to the pelvic floor? It's going to lead to pelvic floor tightness. If the pelvic floor is tight, it's not going to be able to function correctly. You're not going to see improvement of prolapse. You're possibly going to see an increased leaking. So there's just so many things when we look down these rabbit holes of what goes into great pelvic floor function. It's impacted by the entire kinetic chain. Whew, okay, you can see I have a little bit of a passion for this area. All right, so let's head back into the abdominal wall. All right, so one thing I really like to do is start monitoring for diastasis recti early during pregnancy. All right, so how does their midline look when they're getting off the couch or out of the bed? So I like to have my mamas check their midline as they get up off the couch because, hey, everybody's doing that usually at least once a day out of a chair or off the couch. And I just want them to feel it's an easy place to put their hand on their belly and feel what's happening. If they start to feel that area distending when they get off the couch, then that's when I am going to say, hey, we need to take a look at your exercise protocol. We need to take a look at how your body's loading, and we probably need to start modifying some things because the more we stress an area, the more potential it has for damage. So is your belly button starting to pop out? Are you starting to get an umbilical hernia? So understanding kind of what that looks like and then how to give it a little bit of support and make sure we're not excessively stressing an area that has become vulnerable. So having a diastasis during pregnancy is a natural way for our body to handle the growing baby, all right, to handle that expanse. Having a diastasis is awesome, and having a diastasis might have some protective effects for the pelvic floor. But the thing we have to look at is how much is too far and what can we do to help prevent that. All right, so one of the things I like to ask is whenever they start feeling that distortion or distension, whenever they start having a pulling when they go to load their abs, it's probably time to modify. All right, and one of the things that I really love to do after we modify is to improve lateral abdominal eccentric length and overall tension. All right, so the body follows the path of least resistance. If your lateral abs are so tight they can't expand, then all the expansion will happen in the middle. That makes sense, right? If you're not expanding on the sides, you're going to expand in the middle. That means the more give through the linea alba, which can equal more diastasis. So to take the stress off one point, we must put it somewhere else. All right, so I'm going to say that again. To take the stress off one point, we must put it somewhere else. And so that is what we're looking at when we're looking at helping to prevent a diastasis from getting severe. So that diastasis that runs off the midline of the body, what we're looking at is how much do their lateral abs move and lengthen on their inhale so that not all of that system is going out. How well can they continue to connect in the front when they brace or when they exhale so that not all that pressure is going out the front. So we're looking at distensibility and ability to load, and if something can eccentrically load well, it's going to be very strong and it's going to handle things really well. But when somebody's lateral abs are just so tight, I tend to see a lot more distortion in the front and in the middle. All right, so since there's not any research on this yet, and this is my theory from just working with lots of women, I want to share a quick case study with you before we wrap this up. So Laura was a mom of 5 when she came to see me. She had a very large diastasis. She couldn't generate tension in her linea alba. She could stick her fist into her midline. The gap was so deep and large. It was huge. So then through months of hard work, Laura was able to decrease her diastasis and generate tension in her linea alba. She got down to 2 fingers with tension, which is awesome. Then she got pregnant again. So this was the real test. So she went into this pregnancy so educated. And so throughout the pregnancy, she really worked on monitoring pressure, decreasing strain on her linea alba. She still had a diastasis. through the pregnancy, which is completely normal. But when she was postpartum this time, almost immediately postpartum, her diastasis was less severe than any of her other 5 pregnancies, and she rehabbed faster after the 6th pregnancy. She recovered so much quicker. Her abs looked better so much faster. They had function. They were working. She felt strong again quicker. So I think it's such a huge testimony for a mama to say, I recovered better after my 6th baby. But she worked diligently. I'm not even going to sugarcoat that. She did her breathing exercises every single day in her last trimester. She is such a diligent person, and I was so impressed by her consistency, and it worked. It paid off. Her consistency paid off. So I think that's really cool. So I've had several other mamas that have done really well, that have come to see me for diastasis and then have gotten pregnant again and then have recovered better after that pregnancy, which is really, really cool. So this is my non-published case study. That is my opinion. But that's one of the things we'll talk through in the class, is what I've just learned from working with women. So if you want to watch her interview and hear her talk through some of her process of learning, I've got that up on YouTube. So it's a great story. She's really great and really great to share. All right, so a little bit more about the pregnancy and postpartum corrective exercise specialist certification course. This course is not going to cover the basics that you could get off of websites like What to Expect While You're Expecting. It's just not. Like, if you want to know blood volume or you want to know the size of the baby, you can look that up somewhere else. This course is on corrective exercise. That is what this course is on. This course is going deeper. It's not going to say, hey, here, do bridges. It's going to say, here's when I wouldn't do bridges. Here's the thing I see you wrong. Here's how you're going to troubleshoot, like when to do a clam, when to not do a clam, why we wouldn't want to do clams for someone that maybe had some pelvic floor tightness, what we need to do first. All right, so it's going to go deeper on all of those topics to help you understand what corrective exercises are the best to use. The course is for personal trainers, physical therapists, yoga instructors, Pilates instructors, and chiropractors, anyone wanting to learn more about exercise. Exercise is amazing. Exercise is such great medicine for the body. So you're going to learn the best corrective exercises to help women have great pregnancies, recover quickly postpartum, or help with pelvic floor dysfunction and diastasis recti prevention and recovery at any age. So I have helped women with diastasis 20 years postpartum. I've helped women with pelvic floor issues of all ages, and men as well. So this information does carry over to men, because I've actually seen a lot of men with diastasis and men have pelvic floors too. So it's just the human body, and it's really great. But there is a section on pregnancy and postpartum specific, and then we dive into all these different areas. Most certifying bodies accept course credit based on petition. All right, so I even have the form for you ready. So ACE, ACSM, Yoga Alliance, etc. So you just need to check or shoot me an email and I can help you check. So a lot of physical therapy state boards accept the course, since it's approved through the Texas Physical Therapy Association. So this is a little bit of a taste of kind of what the course is like, where we dive into research and then we look at exercises. There's a whole lot of case studies looking at people move and breathe and exercise, and then correcting those movements so you can have your eyes on a lot of bodies. And then if you want to consider, there is 2 course tracks. I just want to tell you a little bit more about them. And I want to tell you about another awesome course that you can take that's free. Before we get off. So 2 course tracks. There's a full support, which you will go through the course with me and another physical therapist. It's amazing. And we will take you step by step through the course. And then there is a self-study where you go through the course on your own. So there's a lot more details on that on the PCS course details page. So be sure to grab that. The link is after this. And then there's also another mini course that is focusing on the postpartum side and kind of just a little bit of some of the fun stuff through the course. And that link is below as well. If you want to go ahead and grab that course and go from one to the other, you can check out the other free course that I did. I think it was 2, maybe 3 years ago, leading in for the PCS course. And the PCS course has had several updates in the last couple of years, because I'm trying to keep the research fresh, because hey, it's fun. It's fun to know what's going on what new case studies there are and what the research is. So I hope that you enjoyed this mini course, and I hope that you join me in the full postpartum corrective exercise specialist course to learn more about helping women.